Today, the World Health Organization hosted an emergency meeting, and the Trump administration once again blamed the WHO for not being forthcoming about COVID-19. That comes as the president also said today that he believes, without offering evidence, that the virus originated in a Chinese laboratory, while the U.S. intelligence community said today that it had made no judgment on that score. President Trump has frozen U.S. contributions to the WHO. The U.S. has been the largest funder, paying more than 14% of the WHO's budget, double the next largest individual country. But as Nick Schifrin reports, the administration blames the WHO for echoing China, and the WHO says it's just doing its job.
Today in Geneva, the WHO's Director General led a rare emergency committee meeting to confront emergencies that are medical and diplomatic.
We shouldn't pretend that because some organization has health in its title, that it's actually capable of delivering the outcomes that we need.
They're literally a pipe organ for China. That's the way I view it.
The administration argues the WHO failed to warn the world about COVID-19 and failed to question China's incorrect initial assessments of no human-to-human transmission.
We give $500 million. We have over the years from 400 to 500 for a long time, for many years. And China is giving $38 million. And yet they seem to work for China.
WHO Director General Tedros Ghebreyesus has pushed back, arguing he has to accept countries' assessments and the organization did its job.
From the beginning, WHO has acted quickly and decisively to respond and to warn the world. We sounded the alarm early, and we sounded it often.
Here's the U.S. criticism. 4 times in early January, the WHO released statements and tweets repeating China's incorrect claims and praising China's response, despite an early cover-up in Wuhan.
I'm declaring a public health emergency of international concern.
By January 30th, Ghebreyesus declared the organization's most urgent warning and continued praising China.
The speed with which China detected the outbreak, isolated the virus, sequenced the genome, and shared it with WHO and the world are very impressive and beyond words.
The administration's critics accuse President Trump of deflecting blame from his own failings and note he too praised China and the WHO early on.
I think China is very, professionally run in the sense that they have everything under control. I really believe they are going to have it under control. We just sent some of our best people over the World Health Organization, and a lot of them are composed of our people. They're fantastic.
Within the framework of the United Nations, a new organization exists to promote the welfare of all people.
In July 1948, the WHO was born with an American Director General and an agenda to help the sick across the world.
All peoples of every race and belief will be helped by doctors from all races and nations.
WHO has launched successful polio campaigns in some of the world's most dangerous countries, like Syria, coordinated and trained vaccine efforts going back to cholera, and battled diseases like Ebola in the developing world. Senior U.S. officials tell PBS NewsHour they're looking to redirect money to other health organizations. But the U.S. might also decide some WHO programs are irreplaceable, Secretary of State Mike Pompeo said yesterday.
If there is a function that only the WHO can do, and we think it is important for American national security because we are good humanitarian partners around the world, I'm confident we'll find a way to deliver that outcome.
So is the Trump administration's criticism of the WHO valid? For that, we get 2 views. Dr. Michael Merson is professor of global health at Duke University. He held a number of leadership positions at the WHO for 17 years, including directing their acute respiratory infections control program. And Lonnie Chin is director of domestic policy studies at Stanford University. He also served in the George W. Bush administration as a senior official at the Department of Health and Human Services. Thank you very much. Welcome to the NewsHour to you both. Dr. Merson, let me start with you. What do you make of the fundamental critique of the WHO? Is it valid?
I think one can argue that the Chinese government did not act fast and strong enough to the appearance of this new coronavirus. They ignored some early signs, and they stifled some whistleblowers, and this needs to be looked into. But I think from the standpoint of WHO, I think they, for the most part, acted quickly and decisively.
So, Lonnie Chin, what about that? Did they act quickly and decisively? And as we just reported, the Trump administration said that they accepted China too much at face value.
Well, I don't think there's any question that the WHO was more interested in this case specifically of parroting what the Chinese government was telling it as opposed to truly evaluating the situation. Now, some will argue that's because of systemic issues at the WHO, limitations on its own power and authority, and that may be, but the fact remains that the WHO waited for 10 weeks between the first manifestation of symptoms in Wuhan before even sending a group of individuals to go to the ground in China to investigate what was going on.
Dr. Merson, we just heard the word parroting, but the WHO argues that it has to pass along what its member countries give it. And in this case, China wasn't giving it anything. And when it did give the WHO some information, it was that there was no human-to-human transmission in late December, early January.
I think very soon, within 48 hours of hearing about this coronavirus, WHO put the word out to institutions in 70 countries about the presence of the virus. They then continued to hold almost daily briefings. They sent information to countries, all of this in the first few weeks of January, about the virus, how it was spread. They were able to share the genetic sequence of the virus so that countries could make diagnostic tests, even begin to make a vaccine. They produced a booklet, information on how you could even go ahead and make a PCR diagnostic test. The Director General and his team went to China to talk to the authorities there. And by the end of the month of January, they had convened an emergency committee that had declared a public health emergency, which is under the international health regulations, the highest alert that WHO can issue. So I think within a month, that's a very impressive track record.
So, Lonnie Chin, what about that? From the time that China did officially declare something in late December all the way through late January, WHO took those steps, and the Director General saying yesterday and for the last couple of weeks that they sounded the alarm early and often.
Well, there were some critical missteps early as well that I think really contributed, unfortunately, according to some scientific analysis, to the spread of the virus much more widely and much more virulently than it had to. So the early notation, for example, on January 14th, essentially repeating China's claims regarding the virus not being transmissible between humans, and in fact, not even providing the same caveats that China provided at the time. That was a crucial early mistake. The failure to, as I said earlier, investigate more thoroughly until mid-February exactly what was happening on the ground. Contrast that, by the way, to how the WHO very forcefully addressed SARS back in 2002, when it sought information from non-governmental sources, when it sought information on the ground, when it actually provoked China to finally admit stuff was going on there in country at the time.
Dr. Merson, when I talk to administration officials, they emphasize that they're trying to get positive outcomes and they want reform of the WHO and to try and give the WHO more power to, for example, not just repeat what China is telling them. Are those ideas for reforms valid? Are they possible?
It's always a good idea to see how UN agencies can be improved. WHO, over its history, has had various looks at how its administration and operations can be improved. But it's not time to do this now. We're faced with the worst pandemic in the last 100 years. We have had mostly so far our attention on initially China, Europe, United States. But the real fear is this pandemic is now going to really strike the low and middle income countries. There are over 110 of these, and these countries depend on WHO for their technical advice, for their strategic thinking, for their equipment, for supplies, and they need WHO. Their health systems are fragile. They don't have equipment that they need, and they're going to get that from WHO. And there's a projection from Oxford that there might be as many as 1.4 million deaths in the next year in these low and middle income countries. So this is just not the time to break the key lifeline that these countries have to keep their populations as healthy as can be. If we continue to have hotspots anywhere in the world, that's a threat to our own security. And that unless all countries are healthy, no country is safe from this pandemic. And by going after WHO now, we're basically threatening our own global security.
And Lonnie Chin, what about that idea that the timing is bad, that the WHO does things that it needs to be allowed to do in this pandemic, and also the criticism of President Trump? Should President Trump be blaming the WHO for some of the mistakes that he's made?
Well, undoubtedly, the WHO does important work, and the WHO is not solely responsible for this pandemic outbreak. But I think we have to take a cold look at the numbers and realize that of the U.S. contribution in 2018-19 to the WHO, only 1.6% of our contribution went to pandemic preparedness and response. The notion that somehow the organization is going to be crippled because the U.S. takes a pause in looking at how it wants to fund and potentially reform the organization, in my mind, is a red herring. We need to continue to ensure the organization is able to do what it does best, but that does not mean by continuing the status quo. And as Secretary Pompeo noted in the opening piece, the U.S. is going to find a way to ensure that critical needs are funded. But the idea that somehow pandemic response is going to be curbed or going to be completely shut down because the U.S. takes a hold on funding is untrue, given the numbers and given the actual contribution we make to the organization.
Lonnie Chin, Dr. Michael Merson, thank you very much.
Thank you.
Thank you.